Hi everyone, welcome back to AskMeDoctor Weekly Q&A. I am Hazel from Motherhood.com.my. Our topic for today is pregnancy myths or facts. Now, a lot of people have heard all these different kinds of tips and advices about pregnancy, but mostly it's around the topic of the sex of the baby, a boy or a girl, and what can a pregnant woman eat or cannot eat during pregnancy. Let's look at the top 10 most frequently asked questions during pregnancy. What are the myths? What are the truths? Today we have Dr. Tan Cheng, obstetrician and gynecologist from Tung Shin Hospital, to answer the top 10 questions that you submitted earlier on our Facebook and Instagram. Hello Dr. Tan.
Hi everyone, Dr. Tan Cheng.
A big bump means a big baby.
Some would say that a neat bump, when it sticks out in the front like a netball, then it must be a boy, and if it's more widespread, spread out in the middle, then it's a girl. There's a lot of sayings around different parts of the world and different cultures, different countries, but they're not really evidence-based. Generally, baby boys weigh more than a girl, therefore it is likely that for the baby boy, the bum might be slightly bigger. However, the position of the baby is the main cause of how the shape of the bum turns out to be. So if the spine of the baby lies alongside of the mother's front, then it will make the belly sticks out a little bit more. Otherwise, the belly will be flatter. We also have to think about the position of the baby inside the womb. It can be in the head down position or it can be in a bridge position, and all this will affect the shape of the bum. You cannot really tell for sure whether it's a baby boy or a baby girl by just looking at the shape of the bum itself.
Now our next question. The baby's kick reveals the gender.
Yeah, there are a lot of folk tales telling about the first kick can determine that it's a boy or a girl. So most says that if it's a boy, it tends to be more active and therefore the first kick is earlier. However, there are a lot of things that actually affects how active the baby is and how much movement a pregnant mother can feel. Most of the pregnant mother will feel the baby's movement around 16 to 20 weeks. This is something known as the quickening. So if this is a second pregnancy, it might be even earlier compared to the first one. Even the second pregnancy, the feeling may also be a little bit different compared to the first pregnancy.
If the morning sickness is bad, or worse if this is a second pregnancy, this is a girl because the female hormone is double. Is that true?
Morning sickness is mainly due to the rising level of a pregnancy hormone rather than the female hormones. It is not possible for you to tell the gender of the baby based on the severity of the morning sickness. The only difference is if you have more than one baby, say in the twin pregnancy, then yes, it's very likely for your morning sickness to be more severe.
So then what are the reliable ways to know the gender of the baby?
There are a few ways, and in fact, you can determine the gender of the baby as early as 10 weeks onwards. Basically, there are two ways. One is by ultrasound scan and one is by a blood test. The blood test, which is known as the non-invasive prenatal testing, NIPT, you can do this blood test around 10 weeks of pregnancy. Normally, this blood test is advised for selected patients in order to screen for genetic diseases such as Down syndromes. This can be done as early as 10 weeks of gestation, which is about 2.5 months. Through this test, you can also know the gender of the baby. The other way is by ultrasound scan. We normally perform a detailed ultrasound scan around 20 weeks to look for any structural abnormality. So this is the time also for us to determine the gender of the baby.
Now our topic is getting more interesting because the next few questions is all about food during pregnancy. If I crave for spicy food, it's a girl. Or if I crave for sweet stuff, it's a girl. Is that true, Dr. Tan?
If I crave for spicy food, then it's most likely a girl. While there are other sayings in other parts of the world that says that if you crave for sweet stuff like cupcakes, then it's likely a girl. However, there is not enough evidence to suggest any of that. There are a few explanations about why a pregnant mother will crave for a certain type of food. One of the explanations is due to the changes in the hormone during pregnancy. Now, as we know, during pregnancy, your estrogen, your progesterone levels all will rise steadily. So if you have PMS previously and you do have craving during the PMS period, during that time of the month, then most likely you will experience a similar craving during pregnancy as well. There are also other hormonal changes in the body, such as chorionic gonadotrophin. There will be changes in serotonin, dopamine, and all of this will actually affect the food craving. Another explanation is that if you're craving for certain food, that means that your body is signaling that you may lack of certain nutrients. For example, if you're craving for meat, it's most likely that your body is in need for iron. If you are craving for salted snacks, you may be in need for sodiums. If you are craving for milk, ice cream, dairy products, then your body may be in need for calcium.
Drink more milk or soya milk so that my baby will have fairer skin. So I heard this a lot of times. Is it true, doctor?
Yes, we do hear a lot of sayings. Some will say that the soya milk can lighten the skin. This is particularly common among the Chinese populations. If you look around the cultures in Gujarat believes that milk is too cold and should be avoided during pregnancy. So you can see that there's a lot of different sayings in different parts of the world. So there's no evidence that actually says that the milk can actually lighten the skin color. However, milk does contain high quantity of calcium and therefore it is recommended during the pregnancy. This is also the reason why that there are so many varieties of different antenatal milk powder available in the market.
You cannot eat crab or sotong because later your baby will be banyak tangan, like to touch here and touch there.
This saying is actually I hear a lot among the Malay populations. In fact, there's a similar saying in the Chinese population as well that if you have crabs during pregnancy, your baby will be more mischievous and sometimes your baby will have more than 10 fingers. There are some other cultures that actually say that if you're eating crab during pregnancy, the child will end out as a thief. So you can see that there's a lot of different beliefs in different culture. The main concern for having seafood during pregnancy is because of mercury contaminations. So there are a few types of seafoods that we do know that may contain high level of mercury and is best to be avoided during pregnancy. So these include shark, swordfish, king mackerel, tile fish. So other fish that are known to be low in mercury and safe to be consumed during pregnancy include shrimps, prawn, salmon, canned tuna, pollocks, catfish. But generally speaking, if you consume anything in moderation, it should not cause any harm to the baby.
Interestingly, there's a research that says Malaysians eat more fish than the Japanese. Now that leads to our next question. Can I eat sushi or sashimi during pregnancy?
Generally, we do not advise consumption of any raw food during pregnancy. Among the raw food is possibility to get salmonella infections, and this infection is caused by a bacterium known as salmonella. It's normally found in raw or partially cooked food such as raw or partially cooked eggs, freshly made mayonnaise which may contain raw eggs.
Now for the next one. I don't like to drink milk. Can I have cheese instead? Can it be an alternate choice for a source of calcium?
Yes and no. Hard cheese such as cottage cheese, cheddar, these are generally safe. If you're looking at ripened cheese like soft cheese, for example, brie, blue cheese, these are not safe as they may contain listeria. Now, listeria is a bacterium that may cause infections known as listeriosis. This can also be found in unpasteurized or fresh milk, which is why we also encourage mothers not to consume fresh milk such as fresh goat milk, fresh cow milk during pregnancy. If you want to have milk or cheese, please only consume the UHT or pasteurized milk. And for cheese, just the hard cheeses such as cheddar, processed cheese slices.
The next question is for coffee lovers. Some people told me that I should cut coffee completely off because of the caffeine. Is it true?
There are a lot of concerns about intake of caffeine during pregnancy. High level of caffeine intake is associated with low birth weight of the baby. However, there's no need to cut out coffee, tea, caffeine intake completely. It's advised that you limit no more than 200 milligrams of caffeine per day. So one may ask that how much caffeine content is there in one coffee? 1 mug of instant coffee is about 100 milligrams, so you should not have more than 2 mugs per day. 1 mug of filter coffee is slightly higher, it's about 140 milligrams caffeine. 1 mug of tea is about 75 milligrams, so also 2 cups of tea should be fine. Coca-Cola, Coke, contains 40 milligrams of caffeine per can. Energy drinks such as Red Bull contains about 80 milligrams per can. You may be surprised to find out that chocolate also contains caffeine as well. So 1 bar of plain chocolates contains about 50 milligrams of caffeine.
Now we are coming to our last question of the day. I understand that I shouldn't be eating for 2, but just additional 200 to 400 more calories from my daily intake. But I'm still concerned, do I have enough nutrients for myself and the baby? What are the supplements that I can take?
Yes, there are a lot of varieties of antenatal supplements, pills for the pregnant mother outside in the market. So what we advise is to have a look at the content, turn the packaging around, look at the content of the supplements. There are a few supplements that is crucial during the pregnancies, namely vitamin D, calcium, folic acid during the early pregnancy, iron tablets. So let's talk about vitamin D. So vitamin D comes in a few different forms. Vitamin D3 is a more potent form of vitamin D. Now vitamin D is important for the body to absorb calciums. So low level of vitamin D is associated with preeclampsia, which is a condition associated with high blood pressure and the presence of protein in the urine. It's also associated with diabetes, smaller babies, and also preterm birth. So for vitamin D, we recommend 400 international unit, 400 IU per day in pregnancy. If you have high risk during the pregnancies, we then recommend 800 international unit per day. Folic acid is important for the development of baby's brain and spinal cord. Normal supplements in the market actually contains 5 mg per tablet, and is more than enough for the requirements per day. We normally encourage mother to take at least 400 micrograms, which is 0.4 mg of folic acid per day. Calcium is important for the formation of healthy bone and teeth. So if you look around the supplements in the market, you can find all sorts of different preparations of calcium, such as calcium carbonate, calcium lactate. So one thing to remember about calcium is it may interfere with the absorptions of other supplements such as iron, and therefore it is advisable to take calciums and other supplements separately. So perhaps if you take calcium in the morning, then you can take your iron tablets in the evening. Calcium may also be found in milk and cheese, and therefore if you do consume high level of dairy products, then your calcium absorption should be more than enough. We do recommend calcium intake of 1000 mg per day. Iron is crucial in the formation of red blood cell. In pregnancy, we recommend the intake of 30 mg of iron per day. If you have anemia, you may require a much higher dose than this. If you look around the markets, there's a lot of different antenatal supplements, and iron comes in a few different preparation or formula. It may be in the forms of ferrous sulfate, ferrous fumarate, it may come in the form of tablets, it may come in the form of liquid. Now some mothers may have nausea, vomiting, constipation after taking iron supplements. Therefore, it is crucial for you to find the right formula, the right preparation for you.
I also heard that omega-3 is the best if I want a smart baby.
Yes, omega-3, DHA, EPA. So there are a lot of sayings right now about consumption of omega-3 will improve the brain function of the baby. The baby will be more clever. Well, there is some evidence that it may help with the development of the baby's brain and eyes. However, the evidence for this is not as solid compared to the other supplements such as calcium and iron. The recommendations of the dosage also depends on which guidelines you are reading. So some guidelines says that you only require 110 mg per day. Some may go as high as 300 mg per day. Now this fish oil, this omega-3, can be found in majority of the antenatal supplements in the markets right now.
Well, what we can see is that food is a hot topic. What you eat during pregnancy is important for your health as well as the health of your baby.
One final reminder for pregnant mothers regarding food in pregnancy is that you should always consume clean, cooked meal and consume everything in moderations. Do not have one particular single items in excess, and generally that is fine.
So we have debunked some of the common pregnancy myths that you have heard. The next time you hear them again, just smile because you know the truth. However, if there's anything that you are worried about or anything you heard that doesn't seem right, do check with your doctor. Sign up Get Top Plus. For 3 ringgit a month or 36 ringgit a year, you get to make your appointment before your next consultation with Dr. Tan. Stay tuned for our next weekly Q&A. Remember, submit your question before Thursday and stand a chance to win free 2 years of Get Top Plus subscriptions and 10 ringgit motherhood.com.my voucher. Thank you for staying through our show. I'll see you soon. To learn more about pregnancy nutrition, tips for breastfeeding and delivery procedure, check out Motherhood Parent Craft online.